Good morning, my name is Manpreet kaur and my student ID is 138211222. Today I am going to do the procedure of neurological and musculoskeletal assessment as being a nurse. So I am done with hand hygiene and I ensure contact precautions. Good morning, my name is Manpreet kaur. I am your nurse for today. What is your name? Can you show me your ID? Thank you. What is your date of birth? Okay, thank you. So today I'm going to do the procedure of neurological and musculoskeletal system on you. So are you comfortable?
Yes.
Do you have any concerns?
No.
Okay. So for I ensure client's privacy and dignity. So I will use proper and systemic way to do this assessment and proper listening skills and questioning skills. So first I will ask you some questions related to neurological system. Do you have any recent fall?
No.
Do you have any recent head injury or past head injury?
No.
Do you have any confusion or headache?
No.
Do you have any neurological illness?
No.
Do you have difficulty while swallowing or while speaking?
No.
Do you have uncoordinated movements while walking?
No.
Okay. So do you have any numbness, tingling or weakness
No.
in the body?
No.
Okay. So now I'm going to ask you some questions related to your musculoskeletal system, which is muscles and joints of your body. Okay. So do you have any pain?
No.
Do you have any weakness?
No.
Do you have arthritis?
No.
Do you have any medications going on for anything?
No.
Okay. Do you have use any assistive device?
No.
What is your activity level in the day?
Good.
Okay. So then I am going to do inspection. So in the inspection, the client is mentally alert and the client is conscious, fully conscious, and now I'm going to check for the orientation. So where are you?
Home.
What is my name?
Manpreet.
What is the time?
10 o'clock.
What is the day today?
Friday.
So the client is fully oriented to time, place and person, and the client CCS score is 15 and the client is fully alert, and the clients look calm and shows no bizarre movements, and the client's mood is appropriate to the affect, and the client is well groomed and well hygiened, and the client doesn't show any bizarre movement, and so if we look at the gait and balance, so the client have steady gait and balance. I'm going to assess for the cranial nerve. So first I'm going to assess for the third, fourth and sixth cranial nerve, which is oculomotor, trochlear and abducens. So for that I will check the extraocular movements of the eye. So you have to follow this pen with your eye movements and don't move your head. Okay. So I will assess for the six cardinal positions. Tell me if you see double. Okay. Okay. So the client doesn't. Do you see double?
No.
So the client doesn't have any nystagmus present and the client doesn't have diplopia and the intraocular movements of the eye are normal. Now I'm going to assess for the parla. Okay. Okay. So the eyes are well, so the pupils are well accommodated to the light, and the parla is also normal. So now I'm going to assess for the intracranial, so the cranial nerve fifth, which is trigeminal. So for the motor function of trigeminal, can you clench your teeth? Okay, thank you. So the palpation and the strength of the muscles is normal, and now I'm going to do the sensory test for trigeminal. Can you close your eyes? Do you sensate it? Where touch?
Yes.
Here?
Yes.
Here?
Yes.
Okay, thank you. So the three trigeminal nerve species, which is ophthalmic, maxillary and mandibular trigeminal nerves, that are intact. Now I'm going to assess for the cranial nerve 7, which is facial. Can you smile? Can you puff your cheeks? Can you uplift your eyebrows? Okay, so the face in symmetry, and there is no facial drooping, and the eyebrows are also in symmetry, and the nasolabial folds are also in symmetry. So now I will assess for the cranial nerve 8, which is vestibulocochlear. So I will whisper just something. You have to tell me back what is this. Okay?
Assessment. How are you?
Okay. So this is also intact. Now I'm going to assess for the cranial nerve, which is the 9th and 10th, which is glossopharyngeal and vagus. Can you open your mouth and say ah? Okay, thank you. So there is soft palate raised and vulvar raised. So this is normal. Now I'm going to assess for the cranial nerve 11, which is accessory cranial nerve. Can you shrug your shoulders? Okay. Can you provide resistance here also? So it's also intact, the accessory cranial nerve 11th. Now I'm going to assess for the cranial nerve 12th, which is hypoglossal. Can you stick your tongue out? Move it side to side. Okay, thank you. So there is no deviation present, and there is no tongue weakness, and the tongue is normally in the midline. So now I'm going to assess for the movement. Can you please move? Walk a little bit. Can you move? Okay, sit down. So the client's movement are coordinated, and the client has steady and well steady and gait and balance, and the client doesn't have any kyphosis and lordosis present while I look at the back, and the client is head, neck, spine and pelvis is in symmetry. Now I'm going to assess for the gross motor functions. So for the gross motor functions, can you please do like this, like I'm okay? Firstly, do this extension of the elbows, extension of the elbows, okay? Do like this, adduction, abduction of the shoulders, okay? Flexion of the shoulders, extension of the shoulders and flexion of the shoulders, okay? Now do internal rotation like this, external rotation, okay? And okay, so this is all normal, and the range of motion doesn't have any limitations. Do you have pain while doing that?
No.
So it's flexible. Now I'm going to assess for the lower extremities. Can you do like this, extension, flexion, move back, okay? Move it sideways, okay, thank you. And okay, can you please move it like that, the arms and the feet, okay? Now move only ankles, move only ankles like this, outwards, that one also, and inwards, okay? Can you move towards your nose? Dorsiflexion is present. Can you move towards floor? Plantar flexion is also present. So the client have full access to the extension, flexion and abduction, adduction, and all the range of motion exercises like inversion, exversion and spination and pronation. So the client movement, body movements are range of motion exercise are normal. Now I'm going to palpate. So on the palpation, the elasticity and firmness of the muscles are present. I'm going to assess for the muscular strength. Okay. You have to provide the resistance again, my hands. Okay. 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 Again the feet. Provide resistance. Okay. Okay. So the muscular strength, if I score them from 0 to 5, the muscular strength is 5, which is full. So now I'm going to, can you close your eyes for the sensation? Will I touch? Will I touch? Where I touch? Okay, so the sensation is present. Do you feel that?
Yes.
So there is no numbness and no tingling present. So I will document all the findings to the physician. Thank you.